Well, good afternoon and welcome to the fifth of these workshops that we've been running to introduce you to the Infection Prevention and Control Manual for older people and adult care homes, and also to give you an introduction to the cleaning specification as well. My name's Elaine Ross and I'll be facilitating today's session, and I'm joined today by Joan Higgins, Linda Hamilton, Derek Cullen from Health Facilities Scotland, and Marie McCary from the Care Inspectorate. So we have specialist advisors for infection prevention and control, Joan and Linda. Derek who will talk to us about the cleaning specification, and Marie who will talk about the role of the Care Inspectorate for the adult services. And we also have Jane here from Healthcare Improvement Scotland, who will be willing to answer any questions that might relate to Health Improvement Scotland later on at the end. Now, the first of these little icebreaker questions, just for fun: if you could go anywhere and you didn't have to isolate when you came back, where would you go? Have a look at your poll function. And I'm going to give you about a minute to answer that question. Marvellous. We'll close the poll there. That's 85% of you have voted. So, and once again, New York is the winner. So on the fifth of these workshops, New York has won each time. Okay, you've got the hang of that. Thank you for taking part. I'd like to introduce a short video from our Deputy Chief Nursing Officer, Diane Murray. She has been instrumental in the development of this workshop. She sponsored the Infection Prevention and Control Manual for care homes, and she's the joint chair of the Clinical Professional Advisory Group that covers all things care homes. So I'm going to hand over now and give us a moment whilst we launch this video of Diane. Thank you.
I am delighted to confirm that the National Infection Prevention and Control Manual for older people and adult care homes was launched on Monday, 24th of May 2021. The manual will include a link to the developed and launched National Cleaning Specification for adult and older people care homes. The manual and cleaning specification will be mandatory for all adult care homes and will be a source of guidance to support these care homes to embed best practice IPC and cleaning into the future and post-COVID. We believe that this manual will help to align practice, monitoring, quality improvement and scrutiny of care home infection prevention and control. Infection prevention and control is everyone's responsibility, and we know that when it is implemented effectively, it is a key safeguard in reducing the risk of infection and outbreaks within care homes, which in turn will keep the care home residents and the staff and their loved ones safe. I want to thank the care homes and partners that have worked with CARHI and the steering group to support the development and rollout of the manual, and to thank you all for coming to the workshop and engaging with Scottish Government and RHI. I encourage you all to engage with this session, read the manual and the cleaning specification, and continue to work with your local partners to support the application of the guidance. Working together, we can continue to provide high levels of care and support in a homely environment and keep people safe. Thank you very much, and we look forward to your active participation. Thank you.
We want to thank you for keeping people safe throughout this pandemic. We know how difficult it's been. We would also like to introduce to you the Infection Prevention and Control Manual, which is designed for business as usual as we go forward, because COVID has shone a light on all things infection prevention and control across the whole of the health sector and even beyond. So the manual has been developed by RHI, which is Antimicrobial Resistance and Healthcare Associated Infection Scotland, in a response to a request from Scottish Government for specific information for care homes. It's been adapted from the National Infection Prevention and Control Manual, and Joan will tell you more about that and the evidence base for it. It's designed to be practical, relatable, easy to understand, and specific to care homes. It wasn't done in isolation. It's been very much a cooperative and collaborative event and construction. And so we're delighted to have involved so many stakeholders. The cleaning specification and the infection prevention and control manual for care homes are mandatory for all adult care homes, and there will be a 3-month implementation period to allow you to get to grips with this, and Marie McCary will talk about the Care Inspectorate's approach to this after that 3-month implementation period. So we want to work together with you to implement this IPC effectively and keep care home residents, staff and their loved ones safe. So today's aims, we would like to advise you of the purpose and contents of the Infection Prevention and Control Manual for older people and adult care homes, and to enable you to access this and confidently implement it. We would like to give you an introduction to the National Cleaning Specification for care homes, but there will be specific additional workshops for those who are more operationally involved in delivering the cleaning service in that care home. So we have 5 learning outcomes, and you will see these referred to as we go through the slide presentation. And now I would like to introduce to you Joan Higgins. So Joan is a specialist advisor working at National High Scotland, and she'll cover learning outcomes 1 and 2. Thank you. Over to you, Joan.
Thanks so much, Elaine, and good afternoon, everyone. And as Elaine said, we just want to thank you all for coming along this afternoon. So outcome 1, so hopefully by the end of today's session, you'll be aware on how to access the manual, what its purpose is, and that you're familiar with its contents. So why was this manual required? Really just through our learning from COVID, it was an ask from the Scottish Government to have a specific manual adapted to have relatable content and be specific for older people in adult care homes. There were some challenges identified with infection prevention control practices during some inspections throughout the pandemic, and there were also some issues seen with environmental cleanliness and some equipment that was contaminated in some areas. Care home is not a clinical environment. We don't want it to be a clinical environment. We know it's the person's home, but we have to make sure that that home is safe. So as Elaine alluded to, this wasn't done just by RHI. We had a steering group set up, and we had all our colleagues from the various organisations you could see on the screen who were involved in the development of the manual, and we are very grateful to their time that they spent with us to get where we were today. The manual was launched after quite a short consultation period on the 24th of May. And as Elaine said, this is our 5th workshop to try and get the main points of the manual across to you. So again, thanks to everyone who was involved. And the people who were around the virtual table then took that to their groups and got a kind of general consensus, and most of the things that were brought back to us we did take on board where they were applicable. So it can be a bit confusing just now, and we totally understand that. We are still, unfortunately, although things are seemingly a bit better just now, although sometimes it doesn't feel that way, but we are still in the midst of a COVID-19 pandemic. So what guidance should you be following? So when there's still ongoing community transmission, the COVID-19 Care Home Infection Prevention Control Addendum still is your mainstay for guidance, and this remains mandatory for all adult care homes. This addendum is disease specific, with control measures over and above the manual to specifically respond to COVID-19. And as Elaine mentioned, this new manual, this will be for business as usual when we're more in normal times within adult care homes. It provides standard IPC and practices for a number of transmission-based infections that are not COVID-19 specific. It should be used with the addendum until the adult care homes are informed by Scottish Government that the addendum is no longer required. And as Elaine mentioned, this new care home manual, it follows all the evidence base of the National Infection Control Manual. We have a group of scientists within RHI who are constantly trawling the literature, all the national and international guidance to look to provide us with the best evidence base for infection prevention control in Scotland. So why does infection prevention control continue to remain important? And this is why. So the people we care for within our care homes are often very vulnerable, and many of them will have underlying health conditions. So it's essential we keep them safe and minimise the risk of them developing an infection whenever possible. At the same time, we need to recognise that this is their home, as I mentioned before, and we want the settings to be safe and also as homely as possible. And as you understand and you live it every day, this is often a difficult balance at times. So infection prevention control, as we mentioned, it does remain important, and it's not just one person's responsibility. It relies on a team approach where everyone involved in care, directly or indirectly, works together to provide safe and consistent practice in a clean environment to those they care for. This is all part of everyone's duty of care. IPC practices should be used wherever care is provided and can be used in all care homes, irrespective of the care provided or whether the care home is run by a third, an independent or a public sector organisation. So it's not just a hospital issue. Good infection control protects not only you and those you care for, but can also keep you and your family safe, as it stops you catching anything and taking it home to your loved ones. The importance of infection prevention control has never been higher, and not just because of COVID. Medicine and care has progressed a lot, so people are living longer, so more susceptible to infection. Infections can have a massive impact depending on the type and severity of infection. For example, from quite mild discomfort to prolonged permanent disability, and in some cases, sadly, death. So not only can it have a massive impact on the people we're caring for, but it also has a huge impact on health and social care services. Dealing with infections costs a lot of money, can stop people being admitted to hospitals, which can then have a knock-on effect on availability in care homes. They cost a lot of money as well, and money is very much needed to keep our health and social care services optimal, as we all want them to be. So how do you find the manual? So we have this manual, and it's a live document, so you'll find it online, and when you go on to the link, you'll see where we've got the arrow there. If you click on where it says Care Homes IPCM, that will take you into the manual's homepage. And this is what you'll see when you click on that previous link. And as I said, this manual is live. It's like the National Infection Control Manual. We can update it in real time when new evidence arises. So this is where we want you to go to find this guidance in the first instance. We've tried to make it as accessible as possible for you, so it's designed for use on mobile devices, and we feel that this may help staff within care homes who won't always have access to a computer or maybe a laptop at work, but they may have a mobile phone that they can access the latest version. And we can also have it available on a tablet form to make it as user-friendly for you as possible. So I really just want to have a chat with you about these are the main contents pages within the manual: roles and responsibilities, standards infection control precautions, and there's also a chapter on transmission-based precautions. So these are our three main chapters within the manual. So this is just a poll. As Elaine said, we're trying to make this as interactive as possible for you today. And it's really just to ask the question, have you previously accessed the National Infection Control Manual before this session? So not the care home manual, but the national one. And we'll give you a minute or so to answer this. Thank you. So but the majority, well, 54% have said that they have used the National Infection Prevention Control Manual before, with 46% saying no. So thank you for that one. So this is just to try and address outcome 2, which was that staff understand their role in the effective application of standard infection control precautions and transmission-based precautions, as we have chapters in the manual. So the role of the care home manager. So what we would hope that the care home manager would ensure that all staff know about this manual and where they can find it and for use in the care home setting. For staff training, that all staff have completed suitable infection prevention control training relevant to their job, and that this is centrally recorded. We would hope that staff are given enough support and resources to allow them to implement, monitor and take corrective action to ensure compliance with the manual. And we would hope that all staff have infection prevention control as an objective in their personal development plans or equivalent, and that they're encouraged to discuss any issues around this with their line manager. So training could include resources developed by your own organisation, your local NHS board or health and social care partnerships, NHS Education for Scotland, or NES as it's abbreviated to, or SSSC. So there's a lot of training and education resources out there. So care home staff, so quite similar to obviously the care home manager. We would hope that that you understand and follow the infection prevention control practice in this manual, that you maintain competence and skills and knowledge in IPC through completing training suitable to your role and as directed by your line manager. And the training, as mentioned before, can be through your own organisation, local NHS board, NES or SSSC. We would hope that staff can communicate infection prevention control practices to be taken by their colleagues, those being cared for, relatives and visitors, without breaching confidentiality, because this is very important. We would hope that staff are able to report to their line manager and document any issues with knowledge or understanding, resources, equipment and facilities, or incidents that may result in transmission of infection. And this might include near misses, for example, sharps injuries or PPE failures. And we don't want staff to come to work if they think they have an infectious illness, because that could then transfer infection to the residents we're caring for, or to their colleagues, which we certainly wouldn't want to happen, and I'm sure you don't either. So examples of this would be having a cold or flu symptoms, maybe some diarrhea, and if you're in any doubt, you need to consult your line manager. And it is very difficult, especially when you feel that your workplace is short-staffed, but it is to keep everyone safe, so you need to discuss with your line manager. And lastly, to contact your local health protection team, or it may be your infection prevention control team, if there's a suspected or actual incident or outbreak occurring. So I really just want to mention elements of what we called standard infection control precautions. And there's a full section within your manual which details these different elements. And as you can see, there are 10 elements of standard infection control precautions. And I'm sure most of you are familiar with these already. And these are how to keep yourself and the people you care for safe. Infection prevention control, it's often not difficult. A lot of the times it's common sense and basic hygiene. But difficulties can arise when the principles are applied in different settings with different staff, resources and different facilities. But all these elements must be used by all staff in all care settings at all times for all individuals. And this is whether infection is known to be present or not. So there's a chapter also on transmission-based precautions. So these are when standard infection control precautions are alone are insufficient to stop spread. And they can be required with certain or known or suspected infections. And how we categorise these transmission-based precautions are by the way the infectious agent spread. So contact is probably the most common way infections are spread in any care setting, and that could be by direct or indirect contact. Direct is usually people's hands, and indirect can be contaminated equipment or the environment. Droplet, for example, flu or COVID-19, and airborne, for example, chickenpox, or when you've got someone who has an infection by the droplet nature, but they're having what we call an AGP, which is an aerosol generating procedure. And these are just procedures that are quite commonly done in hospitals, but can, I know, occur in the care home setting. So that is when something can be classified as airborne as well. So these are just some examples of when we may require transmission-based precautions in addition to our standard infection control precautions. So norovirus, Clostridium difficile, influenza, resistant infections like MRSA or CPE, but they're not specific for COVID-19. You need to still follow the addendum when we're still in the pandemic. So what is the manual? What's the style of this manual? As I mentioned before, it is aligned to the evidence based within the National Infection Control Manual. And any major updates will be communicated to yourselves via the Care Inspectorate. The Care Home Infection Prevention Control Manual uses a more direct style of writing, using short text, instructions and lists, and we feel it's context specific to the care home settings. We've tried to use bullets and photographs to illustrate when to do something and when not to do something, to easily show different sections. So here is just an example. We've just used one section within the manual and the bullets and when or when not to do something. So you'll see ticks and the triangle with the warning sign, just to be aware that there is a potential issue. So here it's in with when we should use soap and water. So a tick to say if your hands look dirty, a warning triangle if you're caring for a resident who's been sick or having diarrhea, and the cross, so you don't use alcohol-based hand rub as it won't work in these cases. So you'll see these signs throughout the manual for all the different sections. So we've included images and web links of posters and the National Infection Prevention Control Manual appendices. And this is just hopefully to help you, as you might not be too familiar with these. We saw that 46% of respondents hadn't accessed the national manual before, so hopefully this will help you be familiar with them. And we didn't recreate the appendices, as these are already used nationally and often internationally as best practice for non-NHS settings, so the web links are provided. So we've also listened to you. There was a plea from many care home managers, etc., and people who are providing advice to the care homes to make it available to print. This isn't our preferred way for you to use the manual because it is a live manual, as I mentioned before, but we have listened to you. We know to make it work for you that you have to be able to print it out. So we're still working on how to print the whole manual, but what you have is you'll see this print icon, and this will be, you'll be able to print off any posters that you require. And also at the end of each section, you have the ability to print off that section. And we are working with our web providers to try and get the functionality for you to print out the whole manual, but we're still struggling a wee bit with that. So bear with us with that, please. So just a wee scenario. So applying the manual in your everyday tasks. So you see a member of staff not using gloves correctly. So how will the manual help you to advise them on when and what type of gloves that they should be wearing? So again, this takes us just to a section about PPE. Before any procedure, you need to think about what you're doing, what you're going to be potentially exposed to, and make sure that the PPE is relevant against the risks associated with the procedure or task you're doing. So there's a whole section on PPE, but we're just trying to show you how you can guide your colleague or member of staff on where to find the right information. So this is just about gloves. So gloves, and it'll tell you when you're supposed to wear them, make sure that they're fit for purpose and well fitting, and changed immediately after each individual and following completion of a procedure or task. And it's also describing the glove chart that you can use to help you select the correct glove. So if I can show you that in the next slide. Thank you. So this flow chart we developed for use within the care home manual, but it's also been adopted in the national manual as well. And it's just a flow chart to help you to decide what type of gloves that you should wear for the task that you're going to do. And just to, at the bottom, you'll see in red, there's a, it's just telling you about vinyl gloves. And they should only be worn, excuse me, for cleaning purposes when detergent solutions only are used. They should not be worn when there's any risk of exposure to blood and body fluids or chemicals, because that's something we did find, that vinyl gloves were possibly overused within care home settings prior to this manual being produced. So another poll. So when should gloves be worn? And if you could just answer one of these questions, please. So let me just see. So delighted to see that 62% of people gave the correct response, which was handling blood and body fluids. We don't need to wear gloves when we're just making up beds. The linen will be clean, unless if we were dealing with any linen that had any blood or body fluids, and we don't need to wear gloves when we're putting out waste or giving out tea. So thanks very much for that. So another wee scenario. So this is just about applying standard infection control precautions in your everyday tasks. So Mrs. Smith developed some loose stools this morning, which is unusual for her. So another poll, making you work for your money today, unfortunately. So what are the most important standard infection control precautions to be used when we're caring for Mrs. Smith? If we can lodge the poll, please. And again, just if you could answer one of these, thank you. So let me see. So here we've got 44% of respondents have given the correct response. So the most important standard infection controls precautions to be used are hand hygiene, resident placement and PPE. We've been a bit naughty here. We've given you some that aren't SIPs. So the first one, mask use. Masks, the use of masks is not considered to be one of the 10 SIPs. It is a COVID specific precaution that we have within the COVID addendum, as is physical distancing. So the correct response here is hand hygiene, resident placement and PPE. There was some thoughts, even the World Health Organization, should mask use be considered to be a SIP, but it's not, it was decided no. So thank you for that one. So just to show you, Derek is going to, our colleague, my colleague from Health Facilities Scotland, is going to go into more detail about the national the care home cleaning specification. So this is just to show you where you can find it within the environmental cleaning section. You'll see that there's a hyperlink, and if you just click onto that, that will take you directly to the National Cleaning Specification for Care Homes. So just to say thank you so much for listening to the introduction of your new manual. I hope you find it beneficial and that you find it useful now that it has been launched. As I say, it was launched on the 24th of May. So I'll now pass you on to my colleague Derek Cullen from Health Facilities Scotland, who will give an introduction to the new cleaning specification for care homes, and as I've described, there is the hyperlink within the care home IPC manual to this guidance. So thank you.
Thanks very much, Joan. And yes, as you say, Joan, my name's Derek Cullen from Health Facilities Scotland, and this part of the presentation deals with Learning Outcome 3, which will give you a high-level overview of what you'll see within the cleaning specification. And there will be also, as we said earlier in the presentation, there'll be further opportunity to attend a cleaning specification specific webinar, and I'll share the details of that at the end of this part of the presentation. So the specification is specifically laid out for those responsible for managing and delivering the cleaning service, and it provides management staff with the necessary tools to guide cleaning staff in their activities. These include standard operating procedures, cleaning records, and action planning. So the cleaning specification was deemed to be required because at the moment there is no national cleaning guidance available, which is specifically for care home settings. And as we're all aware, residents are often vulnerable and susceptible to infection, and also importantly, environmental cleanliness issues are identified during inspections as well. And of course, we have got the ongoing COVID-19 outbreaks going on just now as well. As we all know, governance is an essential part of any process, and we're well aware that across Scottish care homes the structure of the roles may differ. However, it's important that the users of the specification are aware of their required roles and responsibilities. So for this specification, we refer to the following job titles: the care home manager and the domestic staff. So firstly, looking at the role of the care home manager. So the specification states that the care home manager is responsible for overseeing the implementation and the effective use of the cleaning specification, for developing and reviewing the work schedules with domestic staff and agreeing the review processes, allocates resources to ensure that the requirements of the output specification can be achieved. And maybe just to clarify what we mean by resources there, it's not just talking about staffing, but it's also about PPE, materials, machinery, equipment, and anything else which is required to carry out the cleaning task effectively. The care home manager also has a responsibility for regularly auditing the area, ensuring that staff and care staff are fulfilling their duties, that they regularly review areas of responsibility and work schedules, and importantly that action plans are reviewed and any trends that become apparent are identified, which enables a review of service provision and quality assurance going forward. And so the role of domestic staff, which is outlined on this slide as well, I'll just take you through that as well. So domestic staff are responsible for carrying out the scheduled cleaning duties within their allocated areas. They can provide advice and support relating to cleaning issues as well. They have responsibility for general supervision of cleaning services on a daily basis. They also have a responsibility for following the standard operating procedures and the cleaning records contained within the specification, which details routines and duties within each area. And finally, they have a responsibility for reporting and recording when areas can be cleaned, for example, due to access issues, which of course can happen. So the guidance in the specification advises that cleaning services within care homes should be managed in a systematic way, and that the staff responsible for cleaning should be trained to carry out these tasks they are responsible for. As we said, the care home manager is responsible for overseeing the cleaning service, and within the specification this has a number of essential elements, and it's outlined in this diagram that you can see in front of you at the moment. So the system is made up of 4 main elements, and these 4 main elements are planning, designated staff, delivery and standards. So you'll see this when you look at the cleaning specification within section 2 of the spec. Each of these main elements are broken down into activities, and these are described in the blue boxes you can see in the slide in front of you. And when you read the specification, you'll see these explained in further detail. So the tools that are available within the cleaning specification are standard operating procedures, cleaning records, schedules, and cleanliness monitoring and audit and action planning tools. And these are all provided within the specification. They're also available in Word file format, so they can be downloaded and printed off and adjusted according to your requirement. So just breaking those down a little bit then, a wee bit more detail then. So what you'll find is in Appendix 1 of the specification that there are standard operating procedures for 8 different task groups. That is the cleaning of high levels, for example, cleaning of low levels, cleaning of floors, etc. And each of these standard operating procedures is laid out as shown in the slide in front of you. So the way this is set up is that the SOP will show you the required outcome. It will then outline the required equipment and material is next. Then the method is broken down into preparation steps, the steps when you are actually doing the cleaning, and then the after cleaning steps. And the images have been included within all of the standard operating procedures. So that's what each of them will look like. So going on to the cleaning record, so you see an example cleaning record. This is found in Appendix 2 of the specification. So a cleaning record has been provided for the 9 different room types. So for example, cleaning services room, offices, dining rooms, serveries, pantries, etc. But for this example, you can see an example of a residence room and ensuite. The templates provide a list of all the possible elements for each room of that type. So when you're planning the cleaning schedule, elements which don't exist in a space can be deleted from the table for that room, or elements can be added if they're not already on the list. The specification will give you the details for how these can be adapted and completed to suit you. So once the schedule has been completed for the week, it becomes the record, and it will be the manager's responsibility then to ensure good record keeping of these going forward. So cleaning standards and staff performance should be continuously monitored. So audits should be carried out on a regular basis to ensure that work schedules are being followed. The care home manager needs to assess the performance of the staff and ensure cleanliness standards are being maintained. And any identified issues must be recorded and corrected via an action plan. Cleaning standards should be subject to regular monitoring and audit in order to ensure continuous improvement through the identification of any problematic areas. Any cleaning issues should be transferred to an action plan, and there is a template provided in Appendix 3 of the specification, and this action plan is intended to provide support for the manager in identifying the reasons for the issue and to consider and carry out any actions needed to address the issue long term and prevent it from reoccurring. Action planning is part of quality improvement and assurance and benefits care home managers improvement planning by using data which is relevant and is up to date in relation to cleaning activity and practice. So just a quick poll just to ask, it's basically a yes, no or don't know response, but do you have an audit process or tool which you currently use to audit the cleanliness of your care home environment? And if you could just use the poll just to vote, please, thank you. So, so yes is saying 90%. And this has been fairly standard in terms of the webinars we've been carrying out. And so it's really great to see that currently audit arrangements are in place. So I think you'll find that the specification will be useful for you just to confirm your own arrangements and to see if the specification perhaps offers you any other considerations as you take your audit process going forward. So thank you very much for responding to that poll. So just to conclude with me, and just to reiterate what I said earlier, that we are running webinars currently split into three regional hubs, and the dates and times are shown here. So as you can see, the next one for the West region is on the Thursday, the 24th of June. So during these webinars, we will be going through the specification in more detail. So we'll be showing a demonstration of how to use the standard operating procedures and the cleaning schedules, which can then benefit your own cleaning service going forward. So I'd just like to thank you then just for listening. I hope this has been of helpful for you, and if you have any questions, please use the question box. And in the meantime, I'll hand over to Marie McCary from the Care Inspectorate. Thank you.
Thanks, Derek. Hi, everybody. Thank you very much for coming along today. We really appreciate that. I'm Marie McCary from the Care Inspectorate. I hope that so far so good, and that you've had the opportunity to read the new manual, and that the information that you're receiving today isn't coming as any great surprise to you, and that it feels achievable, and also that it feels familiar to you from the original manual, with perhaps the exception of the cleaning schedules. But what I'll do today is have a look at some of the ways that the Care Inspectorate will look at the manual with you over the coming months, and then into September, when we'll start to take it into account at our inspections. So mandatory guidance isn't new to any of you. You're all familiar with it, although you know that we operate to the health and social care standards, and we're hopeful that you implement all good practice that you can, but you also implement mandatory guidance when that's made available to you. And good examples of the mandatory guidance that you follow to the letter are things like fire safety and food safety, and any of the health and safety executives legislation relating to your workplace. So this new guidance is something that I'm sure that you'll be able to implement once you get to grips with it and embed it in your practice. You're familiar with our quality indicator framework. It's been around for a good few years now. We first started to use it in 2017, and until last year it contained 6 key questions. And with the pandemic last year, we published a 7th key question. And again, many of you will be familiar with that key question about how good is your care and support during the COVID-19 pandemic. Like you, we'd been hopeful that the pandemic would be coming to an end by now, and we'd be able to start thinking about removing that key question 7. But at the moment, while we're still in pandemic status, the Inspectorate will still look at key question 7 when we come to inspect your services. But what will happen in the coming year, well, the year started actually, because our inspection year starts in April, so April 21 to 22. What we'll do is we'll still look at key question 7.2 and key question 7.3. But we're starting to look now at the quality indicator framework. So key questions, excuse me, 1.1, 1.2 and 1.3 will start to come into our inspections as we move forward into this year. So what will happen in the next 3 months is that inspectors will promote the use of the manual, the new manual, in the care home sector. So that's care homes for adults and older people. But we'll not take the manual into account when we're determining areas for improvement requirements or grades during June, July or August of this year. But we will start to take it into account from the 1st of September. When we're inspecting you during June, July and August, we'll still be using key question 7 as part of our existing framework. And during the coming inspection year, we'll be working with our inspection partners at Health Improvement Scotland, and in some cases the infection prevention and control teams within your own health and social care partnerships. We know that we won't probably complete our inspection plan this year. We won't have time to do it, and we need to focus on the high risk services. And what I mean by that is areas where there's been maybe a prevalence of COVID, or there's been issues that we've had to look at with you, the service providers, very carefully. So how we determine risk in terms of how we prioritise our inspections is we look at the history of your service, we look at intelligence that's coming into us. That might be coming in via notifications about your service or about complaints. We're also getting information from the partnership visits that are happening in most of your localities. We look at services that have got evaluations of 1 or 2, and we also look at services with outstanding requirements and prioritise these services for inspection in the coming year. I want to just remind you about the facts message and about the pandemic and the use of the addendum. Since the implementation of the addendum at the end of December for care homes, inspectors have taken this into account at every inspection, and we'll continue to use the addendum when we inspect your service. So we would still expect you to be following the addendum and to be ensuring that your practice is safe, and that's in relation to specifically about COVID, rather than the generic message from the new manual that will be good practice for any type of infection, if that makes sense. In terms of the inspection, remember that we'll still look at the addendum and the current guidance while the pandemic is still a focus for us. So in terms of cleaning, for example, and the information that Derek's just given you, we would still expect you to be following the outbreak, the addendum, in fact, and the outbreak checklist and the cleaning recommendations within that. In terms of our legislation, you'll know that you as a care home provider or manager, or if you work in a care home, there is a duty on you to have appropriate procedures for the prevention and control of infection in place. And that's not new. That legislation's been around for a long time now, for 10 years in fact. So we don't use it very often, and the reason for that is because, generally speaking, once you're aware of the guidance and you start to put it into practice and establish and embed it within your service, then you'll follow that guidance, and we don't really need to ask you or require you to implement it. And so it's our expectation that you'll be able to do that over the next few months, embed the new guidance into your practice. And when we come out to visit you, we'll look at how you're managing to do that, and we'll encourage you to do that and promote the use of the guidance in all the services that we visit. I'm going to hand you over now to Linda Hamilton from RHI, and she's going to talk to you about Learning Outcome 5.
Thanks, Marie. Yeah, Learning 5 is just, hopefully I'll be able to take you through some of the support that you'll have for infection prevention control. So as Marie said, I'm Linda Hamilton. I'm a specialist advisor in infection prevention control with RHI Scotland, and I also work in one of the local health protection teams within one of the NHS boards, and I've also been working closely in part of a local care home oversight group for the past year, in fact over a year now since these happened. So just to put a little bit of it in context about the support that is available, I'll just take a little look back at some of the changes that have been put in place over, as I say now, that's just over a year. So if we go back to May last year, the Scottish Government gave some additional responsibility and accountability to an enhanced multidisciplinary group that was across both health and social care. And this included a number of key people, including the nurse director, Director of Public Health, Medical Director, Chief Social Work Officer and the Health and Social Care Partnership Chief Officer. So the remit of this group has been put in place to provide operational leadership, and there was a specific focus on enhanced oversight of care homes. So as a result of that, groups were then set up in each health and social care partnership area to include representatives from all of the people that I've just mentioned. And it might be known as something different within your own area. It could be the Care Home Oversight Group, sometimes shortened to CHOG, could be the Oversight Group, an Assurance Group, or it could be something similar, I would think, to around that. And I would think chances are you already have good links both into as well as out from this group. So in addition to this, nurse directors were given some additional new accountability as well. And this came from the Cabinet Secretary. And it was for the provision of nursing leadership, support and advice and guidance within the care home and also the care at home sector. So whilst the nurse director retains that overall accountability, on the whole, they usually will have delegated some of these roles and responsibilities to senior nurses within your own area. So this means, like the oversight groups, there might be some differences in how this looks or how it functions within each area across Scotland. And that's specifically, you know, it will be designed around the needs of that particular area, which is why there will be some differences. But they do all have a remit for providing the same function. And as again, I would think you'll have links to that person, or it's more likely to be a team of people. So the remit given to the nurse directors, that's been a key role and support and providing what is practical expert advice and guidance in infection prevention control to care homes. And as I said, it might be different. So it could be provided through your local infection control team, through infection control nurses, or it could be through other professional nurse-led care home groups, or it could be incorporated within your health protection team. It could be a bit of a combination. So the professional support teams will work closely with you, and they'll also work with the local oversight group that I mentioned just at the beginning there, to provide the support and guidance that's needed locally and help you through the pandemic, understanding all the guidance that's around. And the oversight groups will also, and most likely, have links with the care inspectorate, either through the relationship manager for that area or the inspector who works within your area. And all of this is to help with good communication and get good working links, and so that everybody's able to support you both as we go through what is, and we still are in the pandemic, but importantly, I think, so that you know that this will be still available as we move into a more business as usual approach, which hopefully we are hoping that we will see that in the not too distant future. So whilst the links with the infection control nurse or that other support team that I've just mentioned might be quite new to you, and in some areas it might still be developing and getting fully established as people are brought into post, but there are other supports and links to other professionals that won't be new to you, and they're still there and still available to you, such as the community nurses in particular, who they're still able to provide you with some support. They'll be working with you in terms of infection prevention control, but also, and probably more so, in other clinical areas, including things like wound management. So a team, I would think that you already have good links with, I'm sure you will, is the health protection team. And they will have been a key resource and source of support and advice through the pandemic, especially in the early stages and during any outbreaks that you might have had. And I'm sure they will be familiar, you'll have had contact with them with things in the past. So whilst we now have that additional and that ongoing support available from the groups and the teams that I've just mentioned, The health protection team, and I think Joan did mention this already, will still be your first point of contact if you have any suspected outbreaks or if you need advice on any specific organism. And I would absolutely urge you to contact the team as early as you can if you have any suspicion or infection of any a suspicion of infection, or if you do have any concerns. Absolutely, we're keen to speak to people early on and just give you that support or advice that you need. And the enhanced arrangements, the additional arrangements that have been provided through the oversight groups or the assurance groups that I've mentioned, these will be kept in place, and there's an agreement that that will be until at least next March, and we'll get more information on that as time goes on. So along with this role and the responsibility and the support through the nurse directors, which again will also continue as we return to greater levels of normality and prepare for and manage what will be the winter period. And I think this is really important to know that that support's ongoing, particularly as you'll be starting to implement the manual and embed your infection prevention control practices and the cleaning specification, which is more new, I suppose, to you. So there is support there. So really just to finish on this slide, the purpose of this really is just to highlight to you that there is support available to you, and just to let you know you're not alone, and importantly that the support will still be there as we move on to this transition to the business as usual, and whilst we do get more familiar with, as I said, the manual and the cleaning specification. So earlier I did say it seems that the support in each area might look different, and we know that it does is different in each health board area. So for us, it would really be quite helpful if we could get an idea of where you currently get your advice and infection prevention control from. So we've got another wee poll for you. So if we could go into the next slide, and then so what we've got is you've got 4 and infection control nurses are your infection control team, health protection team, it could be care home support team, or if you're not sure. So it'd be great if you could just take a minute and let us know. So I think, as in some of the other webinars, the workshops that we've had, we can see as we're getting a mixture, and it does seem to be more that it will seem to come from the infection control nurses, the infection control team, or the health protection team, but the care home support team. It's good. I mean, there's not too many folk are saying that they're not sure where the support comes from. But for anyone who isn't sure, please afterwards speak to some of your colleagues, just find out where that support is available from. And chances are you will know, but it might just be that you don't know the name because it is different names. So that's good to hear, and thanks very much for taking the time to do that. So this is really just hopefully we're coming near the end into just a little bit of summing up in the questions now. But hopefully the learning outcomes, we've had the 5 learning outcomes, and we've covered these, and that we will have met the learning outcomes that we set. But I think we might have one little final poll. It would be really helpful. You will be sent out an evaluation that it would be really great if you, and Elaine will cover this again in a second, but it would be really great if you could take the time to give us some evaluation. But for now, if you could just give us a quick poll at how confident you feel that you would be now accessing and using the manual from the webinar that we've just had. So that would be great, thank you. So that's really encouraging. Really the majority of people have felt it's more confident, yeah, definitely more confident, and that would be that's really, really good. There is one or two that I'm not sure, hopefully, thankfully it's not too many, but it would be really useful even if anyone who feels that there's something that we could improve on that would give us some immediate feedback for next week. If you're happy to pop that into the questions to us, and we can try and see if we can address that for next week. But meantime, thank you very much for doing that. That's really, really useful. And I'll pass you back over to Elaine for the end of the session.
Thank you very much to all of our presenters, and well done for coping with a few technical glitches there, so thank you. And thank you so much to everybody who's taken part in the little fun polls, and I'm really delighted that you feel that you have gained something from this presentation. Now, I've been keeping an eye on the question box, and we'll go through a few. I hope that you will find that your questions have been answered in the question box. I know Linda Hamilton's been working her socks off trying to keep up with them. Now, then I will go to the panel and ask our panel here a few questions. Now, there was something all for discussion rather than anything else. Can we confirm that a new SIPs and TBPs, so standard infection control precautions and transmission-based precautions collection tool, will be developed and released in the future aligned to care homes? Now, I know that Linda's answered something in the chat box, but this is something that if you feel is useful, then please, this is useful information for us and we can look at getting something developed. But at present, there is no new audit tool. And if you come up with something that works for you, then use it and please share it with us. That would be very helpful. Another question that I had, and something we should discuss, question, so significant implications for care home providers. The guidance says if not implementing the risk assessment, implementing the manual, then risk assessment is needed and local advice should be sought. Who or what is local advice? Now, I hope that that last sort of section with Linda has potentially answered that. You go to your local infection prevention and control team or health protection team or care home oversight team and ask them. And we can't spell out everything. These are people's homes. I know there was a question about what's an essential item. Really, you know the residents better than anybody as to what's essential for them. All we're asking that is whatever it is kept clean. Question around about, I'm going to bring it up, about spray bottles. I don't know if Linda or Derek would like to talk about spray bottles and the implications in the manual, or Joan.
I'll come in here, Elaine. Yeah, this has come up at various workshops, both the clean specification and also questions coming into us via the manual. As I mentioned during my section, we base our guidance on the evidence from our scientists, and there's been a recent literature review. It was on water, and the advice that's come is that reusable spray bottles should not be used within any care setting. They've not been used in hospitals for many years because of the risks of contamination. And we understand that this is going to be operationally a challenge for you going forward, but we can only go on the advice we're given from our scientists who we base the manual on. So non-refillable spray bottles can be used as long as the products meet the BSEN standards that are detailed in the manual, but refillable spray bottles, our advice is they should not be used within care home settings due to the risk of contamination. They were implicated in an outbreak, and that's where the evidence, the science has come from. So we can only base our guidance within the manual on the evidence that our scientists find for us. So refillable spray bottles should not be used. Non-refillable bottles, as long as the product meets the BSEN standards, can continue to be used. I hope that sort of clarifies that question.
Thank you, Joan, for that explanation. There's one comment here which I really feel I want to address. It's been a stressful year for all care home staff, and yet we still appear to be the guinea pigs in an area of COVID, in the COVID area. Talks about staffing becoming a nightmare, and you know, it's been a stressful year for anybody who's been involved in healthcare, and I would say at any possible level. So well done for keeping going. Glad you're still there. We're all still here. The implementation of this manual is actually designed to try and remove some of the blame culture that you mentioned in your question here. It's designed to give people simple and relatable guidance, and not to try and apply clinical frontline acute guidance to something that is first and foremost somebody's home. But whilst in that home, living in a communal setting with a number of different people caring for them, is not the same as being in your own home, and so risks of infection are greater, and that's why we need to have some general guidance. Certainly not, we would hope that this is seen as supportive and not as a blame culture. And another question there about inspections, and do all the care inspectors know that this has a 3-month implementation period? And yes, they do. That's been made quite clear. So we wouldn't be inspecting against this until September, and I think Marie made that quite clear. I don't know if you want to say anything, Marie. No. I think we've covered all the answers to the other questions, and they will be summarised and put on the website. There were quite a number of questions around about printing of the manual. It is possible. We're looking to see, can we print it all out in a oner and make it a little bit easier for you? But like many things, this has been developed at pace, so we're working on that. Don't know if there's any last questions. Okay. Well, I'd like to thank all our presenters. Please do sign up for the cleaning specification webinars that will be running on the Thursdays. Your certificates will follow, and we would ask you to complete our evaluation survey. We would very much appreciate your feedback. So thank you. Goodbye for now.